Thank you. Thank you for having me here. And it's wonderful to see all of you here today to understand about speech, language, and communication in children who have learning difficulties. So, I think the request was also more to talk about identifying children who have these kind of communication issues and how do we as educators help them. So, I would like to begin by first thanking you all for being here and then uh, talk about speech, language, and communication, how important they are, and how speech, language form the foundation of how children express themselves, connect with others, their peers, the elders around them. They learn new ideas through language, and it also sort of helps them in building the confidence. So for a lot of children, this is like effortlessly happening and it's so naturally occurring, right? But for many children, this whole process, this journey may not be so smooth. It may have a lot of challenges, like some children may start speaking late, and some may not be able to pronounce words very clearly, and others may not even be using speech for communicating what they want. So the needs are varied. Like within children who are struggling with language difficulties, you will see that there is a range of problems. On that note, I'll just begin by showing you these often talked about sentences. Have you all heard these?
Yes, ma'am.
What do you think about these statements?
Stereotypes.
These are stereotypes, yes.
Ignorance.
Ignorance, great.
Less awareness.
Mm-hmm. So nobody believes that these statements are true. Okay,
No, they're just labeling the kids.
okay. This is a very encouraging start for our session. Yeah, so most often we say, certain beliefs like boys talk late, don't worry. And when they start school, they'll become all right, nothing to worry. Let's wait and watch, wait and watch. So, how long do we wait and watch? Do we wait and just watch, or do we observe and start providing the support as early as possible? That is what we'll be discussing today. Right. So, just to introduce what we mean by language difficulties is, see, speech is the way we express what we are thinking, our thoughts and ideas through language formulations. And speech is just one way of expressing what we want or what we think. But language is something more central, and language difficulties stem when there is problem in acquisition as well as the use of language. And this use of language or acquisition of language can be in both the components, either the expression part of language or the understanding, the receptive part of language. And it can occur across the modalities like spoken language or written language, that is reading, writing, and even sign language. So this can be due to deficits in comprehension or production that include reduced vocabulary, limited sentence structure, impairments in discourse, which means not able to speak continuously in sentences, or not able to take turns during a conversation, or not responding to the listener appropriately. There can be problems and multiple levels of language. On the right side, if you see, there is a little graph there which has four kinds of patterns. The one dotted one that you see here is the typical development of language. So children actually are moving as they grow older. They are learning language, they're improving their vocabulary, sentence structure, and it sort of, stabilizes after a while. And if you see the pattern B here, it is very similar to the normal development or the typical development, but there's always a gap. So these are children who have language issues or impairments, or have like 2, 3 sessions in a week, and this has never happened. So sorry. Yeah. So we were here. We were talking about the pattern D, where there is a kind of, it follows the typical developmental pattern, but at some point, they're losing what they have learned. So there is regression, developmental regression. So these are the 4 patterns that we generally see in children who are learning language. Is it clear so far? We talked about typical development. We talked about children who have some kind of language impairment or disorder, which is the B, where the gap always remains. And there are children with delays, that is C, who are able to catch up after a while. But D is something very concerning, because it is very, you cannot suspect that there is something wrong, at any point. All of a sudden they just lose what they have learned, and that is a very concerning thing. And often you will see history of regression in children who are on the spectrum. Till about 2 years, everything was okay. They had learned to speak and all that, and suddenly they lose their language. So generally, when we look at it, the delay in speech is what many of us pick up, because we don't know what is beyond that or behind that. But what we typically see in children who are probably attending a preschool, or in your neighborhood you see children, the one thing that strikes you is, why is this child not talking enough for his or her age? So that is one of the most obvious signs that we look for. So that could be this kind of a language delay or a speech delay could mean so many more things. From the outside, when we look at it, you just think that this child is not speaking adequately for their age. But what could be the reasons? We'll just go through a small flow chart for us to understand why children need. So, one thing what we see is, if the child is presenting with difficulty in producing or understanding language that affects everyday functioning. You're trying to talk to the child is unable to reply and just showing some, actions. So then what you do? You try to find out if the child is unfamiliar with the local language. Maybe the language that you are speaking to with the child is not something the child knows. Probably that's why the child is not responding. So then what you do is you check whether the child knows any other language. And if the child knows any other language, then there is no issue. But if the child does not know, is not competent in another language also, and is unfamiliar with the local language, if the child is not unfamiliar with the local language, then you see what is the improvement. Is it very poor or slow rate of improvement? No, that means if you are able to provide the input and the child is able to pick up, then there is no issue. But if the child is still not able to pick up, then there is some kind of a language disorder, maybe a delay or a disorder. We don't know at this stage. Right. And for us, the indicators are failure to combine words at 24 months. That means by 2 years of age, a child should be able to at least bring 2 words together to form a short phrase. Mummy park, mummy milk, or something like that. It's not a sentence, but at least 2 words coming together. And by 2 years, the child should have a vocabulary, meaningful vocabulary of about 50 words. That means spontaneously the child should be able to use at least 50 words. Right? So if there are less than 50 words, and if you also see that the child is not understanding what you're trying to say, like bring that bottle, the child is unable to understand and bring the bottle to you. And sometimes the child also keeps repeating whatever you say. What is your name? The child also says, what is your name? right? So these are all slight concerns for us at that age by around 2 years. Then if there is poor attention and fine motor skills, we watch out for that. But language problems, even at 5 years of age, will affect the development of reading and writing skills as well, which is why we are very concerned about picking these cues early and trying to intervene early. So now we were here deciding whether it is a language disorder. Then what we do is we check if there is an associated condition because of which the child is not able to speak. So if there is an associated condition, it means it is a language impairment or language disorder associated with that condition. If not, it is something that we call as a developmental language disorder, which means there is no other issue, but only language is delayed in these children. And what could these associated conditions be? It could be hearing impairment, it could be autism, it could be an intellectual disability or cerebral palsy, or some children have repeated seizures, epilepsy, or it could be multiple disabilities. So now we said if it is not associated with any condition, that means it is a developmental language disorder. Now, what is that? That has no differentiating conditions. And because we say developmental, it doesn't mean that they will come out of it or grow out of it. It does emerge in the course of development, but the child may need intervention in order to bridge that gap. Like if you remember the graph, the C, how, that gap needs to be bridged. They need help with that. And there are no associated condition. There is no hearing impairment, visual impairment, intellectual disability, nothing. There is a question on chat asking if it's social communication disorder. Yeah, social communication disorder also is somewhere in the spectrum. You're right. Right. So now, whether it is a developmental language disorder or it is a language disorder associated with some condition, we also look for additional information, whether there are co-occurring disorders, what are the risk factors, and which areas of language are actually affected. So there could be attention problems, ADHD co-occurring, motor issues like dyspraxia, dysarthria. There could be reading, writing issues as well, unclear speech or speech problems, behavioral, adaptive behavior issues, behavioral or emotional problems. Some of them may also present with auditory processing problems, or it could be an executive function deficit. Risk factors also we have to look for, whether there's a family history, whether there are emotional issues in parent and child, what is the level and quality of parent-child interaction, how is the environment, is it stimulating or is it a deprived environment, were there any pre-perinatal problems during birth or before birth when the mother was pregnant, or just after birth, was there any issue? Is there any episode of abuse for the child? So these contextual information also becomes very important for us to understand the level of delay or disability that the child has with respect to language. And the different areas of language impairment, whether it is only at the sound level or it is at the sentence level. So phonology, morphology, semantics, syntax, pragmatics, all these we look for. Anything so far? Anybody wants to say anything, ask anything? We can then go ahead.
Ma'am, one question. Can we differentiate
Yes,
between language and speech disorder? I think there are two different spectrums, language and speech, when
exactly.
we talk about.
Yeah.
So how
Yeah.
do we, can you explain something about this, ma'am? Speech and
Yeah.
language in a different way. How do we, go ahead with this?
Yeah. So speech is basically, like I said, one form of expressing the language formulations, right? Speech would involve an appropriate voice, a correct pronunciation, and also the fluency of speech. Like we move from one word to the other, one sentence to the other in a smooth manner. So speech problems would basically be maybe an unclear speech. An unclear speech can be a speech or a language problem, right? So if it is a speech problem, it could be because of maybe a tongue tie. And therefore, the child is not able to lift the tongue high enough. And so the D sounds like the dog will become dog, right? And if there is missing teeth or if lisping sometimes, so all these are articulation problems. These will be speech problems. Whereas if there is an unclear speech but it is very inconsistent, like the child is able to say "the" in drum or some other word, but when it is dog, the child says gog because the occurs in the end. So those kind of influences, that is a separate category called phonological disorder. So that will be more of a language problem. So speech problem can be these kind of articulation problems. Then there could be a stammering or stuttering, what we call. The fluency is affected, right? The child may say pen instead of pen, repeating a part of a word. Like very young children will repeat the whole word or whole sentence sometimes. I went to, I went to the market yesterday. So that doesn't become stuttering or stammering, right? Because they are repeating the whole word or the whole sentence phrase. So that is also a speech problem, stammering. And if they have like very hoarse voice or due to excessive screaming, voices change. So all these become speech problems. Whereas language problems would be, you see inadequate language for that age. Like the child is 5 years old, but only speaking in 2 or 3 word sentences. Or the child may not know how to use language in a context. Maybe it is a classroom and the child is speaking like how he would talk in a birthday party. The use of language in a social context, the pragmatics may be affected there. So there are, and again, language delays or language impairments are seen in a lot of children with associated conditions like hearing impairment or autism. So that is also a way that you can differentiate. Does that answer your
There's one more
question?
concept. Yes, ma'am. Correctly, ma'am. Thanks for the details. There's one more in speech. They say the GLP. There is a processor. They who keep repeating. What is that, ma'am? Like many kids are, like my own son is ADHD. Keeps repeating. So
Gestalt
does he
language
come under
processing, is
category?
it?
Yes, ma'am. Yes, ma'am. Yes,
Yeah,
ma'am.
yeah. So you're coming back to echolalia.
Yes, ma'am.
Hmm, hmm, hmm. Yeah, so this is in context of children on the spectrum, autism spectrum, right? That you're asking?
Yes, ma'am. Exactly. Yeah.
Yeah. So it is also like linked to a certain theory called weak central coherence, where children on the spectrum are able to get into details and not really getting an overall or a gestalt picture of the stimuli, which is also reflected in their language. Yeah. All right, so we'll just move forward. We know that language problems, we can look for language delays or disorders through this flowchart that I just explained. But why do these children need help or support? Because, like I said, there is a range of difficulties that these children come up with. It may be in producing the speech sounds or the sequences of sounds in words while talking, or it could be in the area of understanding long verbal instructions, like 2 or 3 instructions, one after the other. They are unable to process it, or finding the right words or structure sentences used in everyday context and in social situations. They may have difficulty staying on topic, ask and answer questions, or follow the rules of conversation. They may have problems in regulating the volume, pitch, resonance, intonation, overall quality of their voice, and also fluent speech may be a problem. So, for all these reasons, we will need to support them so that their communication becomes smoother. So, speech therapy or speech language therapy, what we call, can be either speech focused or communication focused. When it is speech focused, we are basically trying to get the child to use oral language more effectively. Whereas when it is communication focused, our aim is to get the child to engage in reciprocal social interactions in whatever way, not just using speech. So, a combination of both is useful, and it also depends on the kind of difficulty and the level of difficulty that the child has. So, what is your focus is up to the therapist, the family, teachers, and everyone to decide. Some of them think that if we focus on communication by using alternative ways to help them express themselves, then they may not, be motivated to speak. But that is a myth, right? You might have heard of things like AAC, alternative and augmentative communication. So what basically happens is when they find a channel to communicate, they will at least be able to express their thoughts and feelings, and the frustration level comes down. And speech requires the coordination of a lot of speech muscles and the brain to coordinate these. So if they have the potential to speak, they will at some point. There's no point in drilling them and getting them to just to express through speech, and that leads to actually frustration because they have so much to say, but just because they're not able to speak, one cannot stop them and expect them only to use that one channel of communication. So then that's how the communication focused therapy will aim to bring down this frustration level, help the child express what they think, what they feel, and also slowly get into reading and writing academic skills using different modes, not just using the oral and the speech mode. So in a speech-focused therapy, the goal will be for clear speech production. For example, if the child has speech issues, some unclear speech because of some structural issue or a functional issue, then yes, you can do a speech-focused therapy and bring clarity to what they are speaking. Whereas a communication focused therapy, the goal will be for functional communication. Is the child able to express when he is hungry? The child wants to go out. So that is the focus here. The complete goal differs here. And who does speech focused therapy help? Children with unclear speech or sound errors. And communication focused therapy helps most children with delays in using or understanding language. The modality in a speech focused therapy would be primarily a verbal one, whereas in a communication focus, we also do verbal and non-verbal. It's a combination. You can use alternative communication, you can use gestures, signs, whatever works with the child. The tools that we use are basically articulation cards, drills, oromotor exercises, and all in the speech focused therapy. Because you want clarity of speech, you want these muscles also to have the strength. So then you do that. Then in communication focused therapy, you use like picture exchange communication system, AAC, variety of things, playway method, modeling, different techniques that we use to build up and break down what we say. Outcomes in speech focused therapy is improved sound clarity or speech clarity. Whereas in a communication focused therapy, the outcome will be an improved ability to communicate needs, thoughts, and feelings. In fact, we also have non-speaking individuals who are writers, who are doing quite a lot of work. Just because they're unable to speak, they have found other channels of communication and they're doing really well. Now, we'll just think about this child. Can you see Arav's case? Does anybody have any answer to this? Say this child is probably around 3 years old. What do we do?
I think we should meet the parent and find out
Mm-hmm.
how the home environment is, and we will definitely get to know the impact of home environment.
Yeah.
And also, probably, if we could start helping ourselves in enriching the child's vocabulary or adding words, if that's the
Mm-hmm.
initial development that we can offer, then
Mm.
we should start working on it from home and school. If that
Okay.
doesn't come together, then probably we should guide them for an assessment to find out what exactly is wrong and there is an evident delay.
Excellent. Yeah. So, do you feel that this child needs to be referred for speech language therapy? Because the child is almost 3 years old and he has only 3 to 4 words in his vocabulary, in his spoken language, oral language. Whereas we said by the time the child is like 2 years of age, they should have at least 50 words in their vocabulary. And you may also see here that the teacher is often that notice that the child plays alone and does not even try to imitate his classmates. So, does that signal something to you?
Yeah, there is
Ma'am,
evident speech
maybe
behavior.
spectrum. He
Yeah,
must be on the spectrum, or
There
could
may be
be,
hearing problem,
could be.
could be,
Ma'am,
and
Ma'am,
the
we
ma'am,
need
capacity of
first
to.
the
thing,
child may be the less.
ma'am, first we need to uh, instruct the parents to get a developmental assessment.
Okay. Yeah, which is what.
Or, or ma'am, we can probably send them for a screening test
Mm-hmm.
to identify any kind of development delays, or for hearing, or then or maybe the child might be on the spectrum because he doesn't even respond to his name.
Mm.
And the speech is limited, so maybe first a screening is suggested, and then probably if that shows some results, then the further diagnosis can be done.
Who does this screening?
um, Psychologist, ma'am.
Child psychologist.
Psych
So,
or
an
pediatric.
evaluation or an assessment can be done by a psychologist, but a
Yes.
screening is a very simple checklist which the educators can also do.
Okay.
So I think that would be the best way forward. I mean, there has been some confusion because the child does not respond to his name. Somebody said he may have a hearing problem, but you also see that the child prefers to play alone and does not imitate his peers. That is also pointing towards autism spectrum.
Yes, ma'am.
So the best thing would be to speak to the parents, like somebody said,
Yeah.
and then do the screening as a teacher, as an educator, and then refer for detailed evaluation. And once you see the report, then you decide whether this child would benefit from a speech language therapy and refer them for that.
Right, ma'am.
Yeah. Thank you. Thank you all for your responses. I will just play a quick video. Although it's not in the Indian context, but I think it's a useful video to watch to get some idea about the signs that we need to look out for. Okay, just hold on. I didn't share the sound.
Quite often when a young child is screaming, hitting and biting, it's actually caused by delayed language skills. When a child doesn't have the ability to communicate their wants and needs by using their words, they can become frustrated and express that frustration through socially unacceptable behaviours. And unfortunately, when our toddlers aren't talking by the time we expect them to, it's also really common to be told to just wait and see if they catch up. But If a toddler does have a delay, they generally won't catch up without a little bit of extra help. So it's really important to be proactive as soon as you notice a speech delay, rather than just waiting and hope to catch up. So to help you identify potential delays early, I'm going to walk you through 5 key signs that indicate your 2-year-old has a language delay. Now, if you notice these signs, it doesn't necessarily mean your child has a speech delay, but if you do notice any of them and you are concerned, I recommend you visit a speech language therapist to get an assessment done as soon as possible. That way, if there is a delay, you will be able to get your little one the help they need as quickly as possible, and the earlier they are able to begin therapy, the easier it is to resolve a delay. That said, here is what to look for. At 2 years of age, children will continue to use gestures such as holding their arms up when they want to be picked up, waving hello or goodbye, clapping their hands, shaking their head for yes or no, and pointing to an object which is out of reach. But we also expect them to start pairing these gestures with words, rather than just relying on the gestures alone to communicate. So for example, instead of just holding their arms up to tell you they want to be picked up, they will now say up while holding their hands out to you. If your 2-year-old still prefers to use gestures alone instead of pairing them with a word, it could be a sign of a language delay. Under 2 years of age, it is also really common for toddlers to copy the words you say. For example, if you held out a bottle and said bottle, they would immediately repeat the word bottle back. But by 2 years of age, it is expected that your toddler can say 50 or more words and that these words are spontaneous. And by that I mean your toddler automatically says the word without needing to copy you. So if we were to use the bottle example again, instead of waiting for you to say the word bottle and then repeating it, your toddler would see the bottle, recognize they want it, and simply say bottle. In addition to being able to say 50 or more words, children who are 2 years old should also be consistently starting to combine the words together to make 2-word sentences. For example, instead of just saying bottle, they may now say more bottle, or instead of saying up, they may now say mum up. So if your little one can only copy speech or actions and doesn't produce words or phrases spontaneously or says less than 50 words, it could be another sign of a language delay. At 18 months of age, your toddler should also be able to follow a simple one-step direction without needing any gestures from you. So for example, if you ask them to give you their teddy, you could simply say, give me your teddy, without actually needing to hold your hands out to prompt them or point across the room to the teddy. And by 2 years of age, the level of understanding should have continued to improve and develop so that they're now able to follow a simple 2-step instruction like give me the ball and the car. If you notice that your child seems to have a difficult time following directions at 2 years of age, this may also indicate a language delay. On that note, I've created a free communication milestone chart that you can refer to that will tell you what your child should be able to understand at each age, the number of words to expect at different stages, and when to seek help. So if you'd like to download a copy for free, just go ahead and click the link in the description box below this video. Next up, by 2 years of age, your child should be able to recognize common words and be able to point them out when asked. For example, your 2-year-old should be able to point to at least 2 body parts when they're named, like their hands, feet, or head, as well as point to common objects or pictures in books when asked. So when you ask your child, where is the dog, while you're looking at a book, your 2-year-old would point to the picture of the dog. In addition to being able to identify and point to common objects, your toddler should also be able to tell you what the item is when you ask them. So, for example, if you pointed to a picture in a book of an object that they know, like a teddy, and said, "What's that?" your toddler should be able to say teddy. As your 2-year-old is still learning how to say words, it is extremely common to find it difficult to understand everything they say. However, at 2 years of age, parents and regular caregivers should understand 50% of their child's speech. Now, if you notice that your little one is not yet talking as expected, remember the first step is to have their hearing assessed to ensure that the cause of the delay is not due to hearing loss. And after that, you should book an appointment with a speech and language pathologist, which are also known as a speech pathologist. If your child isn't showing speech delays, but you would like to take proactive steps to help teach them to talk, make sure you check out this video next to discuss.
Yeah. So she was talking about the early signs that we can catch on. Um, Was that understandable? Any one or two that you picked up? Can anybody say?
Like less than 50 words of vocabulary
Yes.
at the age of two,
Two.
and can't point and tell the in words like
Hmm. Hmm.
pick up or bottle.
Yeah.
They said bottle. So
Hmm. Hmm.
those words, if they are not able to say, only they are
Hmm.
pointing,
Hmm.
then there is a language delay.
Okay. Yeah. Okay, thank you. There is a question on chat. Why does the child talk to themselves sometime? So that is also a part of development, and it leads to self-regulation. See, there is a lot of connection between what children are processing in the world around them, right? Their cognition is actually growing, and that is also related to language. So thought and language are so related. Sometimes they are thinking aloud, so they are using words to say whatever they're seeing around them and whatever they're thinking, what do they want to do next. So slowly, it's like instructing themselves. And, interestingly, in some of the theories of cognitive development, you will see these being described. So it is a stage of development in children. Excessive self-talk, while excessive self-talk may be a problem, but self-talk generally is a healthy sign that the child is thinking and growing. I hope that answers your question. Yeah. So we were here.
Ma'am, but one question, if the self-talk is too much,
Yeah.
do we
Excessive
need to
self-talk is a concern.
assess
Yeah.
assessment? We need to do an assessment for speech and language like therapy
Depends
for
on the
that
age of the
assessment.
child as well. How old is this child?
Okay, ma'am.
Yeah.
No, does this self-talk go by age or does it prolong, and how does it matter? A child under spectrum.
For a child on the spectrum, there will be self-talk, and one needs to tell them to move towards their mind voice. So it's a process. Like you cannot stop it, but slowly bring it to whisper, and then you bring it down. So see, it's also a way that they are self-regulating. For example, if we give them an instruction, they would say it louder to themselves, like they do self-talk, just to remind themselves that this is what I'm supposed to do, this is what I'm not supposed to do. So then we move to a stage where we teach them and then ask them to think about it. We say, no, we don't say it loudly, we use our mind voice.
But mind voice, I think, is a higher term for the younger kids, the one who are
They
in
do
grade
pick
one
it
or
up when you
I2.
keep on exposing them to that. Think about it. Don't say it out. Just think about it. So that's why I said you can maybe bring to the next stage, like whisper, and then go back to thinking about it. But it does reduce if you intervene. Yeah. Yeah.
Okay. And how about seeing in the mirror and continuously talking? Because my son is under spectrum, he's ADHD, but he continuously sees a mirror and talks. So how do we judge this kind of a behavior? He's talking
Mm-hmm.
but seeing the mirror. So
See, again, it's a healthy way of having, maybe he's just developing self identity and also looking at himself and talking to build confidence. But then when it is excessive, you need to intervene. You need to provide some alternatives. You have to
yeah, so that
transition from looking at the mirror to this. Then you say few for 5 minutes, this is fine. Maybe you can set a timer and say, till then you can do this. After that, you have to turn to me and talk.
okay. So the more we intervene
Yeah,
and
some kind of
give the
structure.
regular
Yes, you need. Yes,
structure,
it requires
so it
intervention
would
and
minimize.
yes, yes.
Ma'am, the child under spectrum, maybe they are not able to express their like expressive language is
Hmm.
not there. So
Hmm.
is this that's why they self-talk to themselves like?
No, it's not that. See, the problem comes not with expressing. See, there is a problem with expression for some of them, but for some of them, it's also expressing it to other people, right? They're quite
Yeah,
uncomfortable in social situations, and even looking at the face is very overwhelming for them.
yeah.
Which is why they
Like
prefer to
sometimes
look
if
at
they
them.
are upset for some reason, like they are angry or
Hmm.
something, that something happened to them, and then the
Hmm.
self-talk increases. That is that a way?
It could, because see, I would say then that is a very aware child because they are trying to self-regulate by talking to themselves.
Okay.
Yeah.
Yeah. Thank you.
Because some other child that I know would just have a meltdown. If the child is able to do self-talk, which I think is a good sign, and we can
No,
shape it up
that
slowly.
that child is under spectrum, so that's what I'm asking. So is this
Correct.
the
I
way to
understand. The child is on the
regulate
spectrum.
their?
The child is trying to regulate their own behavior by talking to themselves.
Okay.
Yeah.
So, but sometimes like
Also,
how to tell them to not to talk loudly, like because that
When
the other
it is
people may
excessive.
miss.
Yeah. Yeah. So see, generally what we also do is have color cards.
Hmm.
In a card like a long one, we have different colors, and we each color is a certain level of talking. Like red would be yelling, yellow would be whispering, like that. So you color code it and you point to that, saying this is the level that you need to use.
Okay.
That really works with these children because visuals generally work with these children.
Thank you, ma'am.
I mean, one more doubt. Expressive language, for example, like with my own son, when someone pushes him, he's unable to express and tell by
Nikita,
language
one
that
second.
don't do this. It's hurting me. They are unable to express
Mm.
me. So
Mhm.
that's the thing that happens because when they communicate with neurotypical in a school, when they are in spectrum
Yeah.
kids, the neurotypical are unable to understand them because they are all young kids.
Yes.
So once the
Yeah.
child for bullying or they push them, they do some
Yeah.
teasing. These kids are very
Yeah.
unable to, express. That time it is really a sad situation wherein my child is unable to express himself. Someone
Yeah.
is pushing, but he is unable to tell. So I have to tell and intervene in
So
between as a mother.
typically, how we
So
work with
that's
these issues is we teach them some catchphrases. Don't do that. I don't like it. So these kind of things. No, we train them to say this, and you do scripting. You create similar situations at home, and you teach them to say that particular sentence or a phrase.
I mean, the social
Yeah,
stories clip boards which we have read, like
that can also
flashcard,
help.
social
Yes,
stories.
yes, yes. Maybe we can discuss this more towards the end of the session. Yeah. Right.
Yeah,
So,
Bhuna, I think it
just
will be nice if you can probably finish this session and then we have the question answer so that your flow is also not uh, restricted.
sure,
Yeah.
sure. Yeah, yeah, yeah.
Yeah, I
Thanks.
think that will help others also. Yeah.
Sure, sure.
Yeah, you can type your questions in the chat box
Yeah.
so that it is not missed. Yeah.
Yeah, sure. So yeah, moving forward, there are some common signs and red flags. Just for information, I have put it here. Anyways, I'll be sharing this slide so you can have a look. Lack of eye contact or social smile. We are talking about infants 0 to 12 months. By around 2 months or so, the social smile comes. And then even by 3.5 or 4 months, you don't see that social smile, then again, it's a concern because children on the spectrum have a history of not having this social smile. Then doesn't react to sounds or voices. indicating hearing problems. No babbling or cooing by 6 to 9 months, again, could be hearing problems. Like, in very young infants who have hearing issues, if it is undetected, they may start with like ba, 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 da, 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 this kind of repeated or canonical babbling, what we call. But, children keep doing that repeatedly, and then they get their own feedback, right? So they keep experimenting with different consonants. So that doesn't happen in children with hearing impairment, infants with hearing impairment. And there may also be feeding difficulty, sucking, swallowing problems. We don't know. It could be some oral musculature issue, cerebral palsy, mild, or cleft palate. So by 12 months, the baby isn't using gestures like pointing, waving, or showing. Then it is also a concern. Toddlers, I think that video talked to us quite a bit about the signs to look out for in toddlers. The additional thing here is echolalia, repeats others' words but doesn't use them meaningfully, and uses gestures only without verbal language by age 2, which is also something that was there in the video. Preschoolers, speech is difficult to understand by unfamiliar adults because by the time they are 5 years old, at least 75% of their speech should be understandable to even strangers. Difficulty forming sentences or using correct grammar, poor vocabulary or difficulty finding words, avoids talking or playing with peers, does not understand stories or questions, gets frustrated when not understood, and cannot answer simple WH questions by 4 years. And this can manifest differently depending on what the condition of the child is. Suppose the child is on the spectrum, then you will see that there is limited eye contact, no joint attention, very poor or inadequate speech, flat or unusual tone. So it's like a robotic voice. There is no ups and downs. There is no emotional component coming in there, and they don't wait to take turns during a conversation. They will blurt out in between. Then hearing impairment. Like I said, babbling stops after a few months, uses gestures instead of vocalizations, delayed comprehension. Cerebral palsy, if it is mild, then there is the speech clarity will be poor, difficulty controlling breath and mouth movements, drooling, low verbal output. Global developmental delay, there will be delay across all the domains. Language is also affected, both receptive and expressive language. Pretend play will not be there even in autism spectrum disorders. Most of the children don't go through that stage. Speech sound disorders, it is basically unclear speech. There are errors in specific sounds. Developmental language disorder, which we just discussed in that flow chart, was earlier called as specific language impairment. So they have below age level language, but there is no other issue. Their hearing is okay, they are able to see well, intelligence, everything is fine. So, but they have a language problem. These are the children, at least a significant portion of these children grow up to have dyslexia, dysgraphia in the future if you don't give intervention. So even in specific learning disabilities, as you know, everything else is okay, but still they have poor reading, writing skills, right? So it stems from a fundamental deficit in language processing. Okay, these are quick questions. Any 2-3 responses, and then we can move forward. Baby Arya, 10 months old, does not babble, doesn't respond to her name, and does not make eye contact when interacting. What will you refer Arya for?
Hearing check.
Okay. Only a hearing check?
First hearing check
First
and
hearing.
then maybe early intervention
Early
of
intervention.
child for assessment with psychologist.
Raju, almost 2 years old, mostly points and cries, uses only 3 words, and does not follow basic instructions. What concerns would you raise with caregiver?
Cry.
Screening first,
Okay.
then detailed evaluation.
Okay. What will
Maybe talk slowly with the child. Maybe just use
Okay.
few words rather than talking like using many sentences. Maybe that would help in this case.
Okay. Uh-huh.
Speech therapy assessment has to be
Okay.
done because it's under 2-year development very clearly.
Mm-hmm.
Try
So you tell
try
the
to give
parent,
more word supply.
okay, by giving a very stimulating environment. Okay. Great. Zoya, 4 years old, speaks a lot but uses very incorrect grammar, struggles to tell a simple story or answer questions about her day. Her teachers say peers often don't understand her. Would you consider speech therapy?
Yes.
Yes.
Maybe communication therapy. Yes.
Communication. Great.
Communication.
Speech language therapy, which is focused on
Yes, speech
communication,
communication.
also speech focused, right? Because the clarity is also not there, because peers also don't understand her. So a combination of both. Great. So there is a recognition now that children who are unable to speak clearly or not, who are not speaking adequately, need to have speech therapy, speech language therapy. But why should we start them early? Should we refer the child at 4 years of age or at 2 years of age? Which would be better? Sending the child earlier for therapy is always better because there is a sensitive period for children when they're actually picking up language. And if you're able to provide maximum during that time, it's also the time when the brain is very plastic, right? It's able to absorb a lot. Rapid growth of the brain happens at that stage. So you can capitalize on that and actually provide systematic support, structured support, so that the child is able to pick up. And if children don't receive the right stimulation during this window, future learning can be more difficult. So at that time, if we lose that opportunity, then we have to work twice harder to actually work on the child. The earlier a child receives support, the more likely they are to catch up to peers and build strong lifelong communication skills. Example, a child receiving speech therapy at age 2 may develop age appropriate skills by age 4. The same child starting at age 6 may need years of intervention to achieve the same result. So, a quick summary of what we discussed, the red flags that we saw by the infancy, the 0 to 12 months of age. We know that listening skills are developing, babbling, joint attention, all that is developing. So, we have to watch out for a lack of response to any kind of sound stimuli, whether it is words or whether it is some noises around, and no babbling. In the toddlerhood, like 1 to 2 years, you see that first words will come up, then they're able to follow simple commands and they're using gestures and what they learned in combination. So then what you look out for, fewer than 10 to 50 words, not pointing or imitating. 2 to 3 years, they have to start combining words, following little more complex directions. So if they don't do that, then it's a concern. 3 to 5 years, complex sentences start appearing, grammar also falls into place. Then they start telling stories, whatever happened in school, whatever happened at home, whatever happened in the park, everything they're able to create stories. So there you look for unclear speech, grammatical errors, and if they have difficulty in retelling either a story or incidents. So the takeaway for us in this whole discussion is the longer the delays go unaddressed, the more a child's social, emotional, and academic development is affected. Because, like we said in the beginning, speech and language is forming the foundation for children to develop in other domains, relate to people around them, relate to things around them, and also give them a segue into reading and writing academic skills as well. So we are revisiting these. You just have to tell me your opinion on this. Late talking is normal, is it?
No.
No.
No, ma'am. No.
For
No.
speech delays?
No.
Sorry?
Children.
It depends on what kind of a disability the child is facing.
The
It
level
depends
of
on child to child.
level of difficulties.
Yes. So some children may be able to outgrow, but some children may not. Some children may be able to outgrow with structured support, but some children may need it for a longer time. So one cannot make a blanket statement saying all children outgrow speech delays. Speech therapy is only for children who don't talk.
Not exactly, ma'am.
No, ma'am, it is also for children who have stuttering and
Stammering.
fluency issues.
Correct. Bilingual homes cause speech delays. The child is exposed to two languages at home.
Maybe.
Maybe,
Maybe.
not
Depends,
exactly
depends,
like.
Maybe.
depends child to
Depends on
child.
how they talk to the child.
Okay. So there are so many factors, right? So bilingual homes as such don't cause speech delays. The child has no predisposition. The child has everything, all boxes ticked. There's no problem during birth, before birth, after birth. There's no reason why the child shouldn't be speaking. Then, exposure to two languages is perfectly fine. It does not cause a speech delay. In fact, children who are exposed to two or more languages have better cognitive skills. Okay. Now, coming to what happens inside a speech therapy session. Many of us are curious to know. We refer for speech therapy, but what do they do there, right? So, what the speech therapists actually do is do an initial evaluation where they assess the speech, language, and communication abilities. They may do observations, they may use certain standardized tools or checklists. Some of them are listed here, like the receptive, expressive, emergent language skills or the clinical evaluation of language fundamentals. There are several other tools for each component of language. You have language tests. So they may use that. They may also interview the parent extensively and also get in touch with the teacher to understand the current status of the child. And it will be mostly a play-based interaction. That is how they gather the information about the child and place the child in a certain category. For example, the child is maybe 3 years old, but the child does not even have just has 2 or 3 words in their vocabulary. So, what is the language age of the child? That is what they're trying to find out, because then they know the intensity of the stimulation that needs to be provided to bridge that gap. We'll watch a quick video, but before that, I'll just tell you what are the areas that the speech language therapists are assessing. One is, of course, the expressive and receptive language. How much is the child able to produce, say, express? And then what is the level to which the child is able to understand language? Then they also look for the clarity of speech. They look for social communication, and they look for oromotor function. Like, is the oral musculature good enough, strong enough for the child to actually speak? But if there is a weakness there, then the goals for therapy will be different, which is why these kind of assessments are done. I will just share a quick video to show you how language therapy happens. Maybe we may not watch the full video, but to give you a glimpse into it. This is again not the Indian context, but useful.
We're gonna get started with the magic bag.
Is it audible?
What's in there today? Can you sit on your bum? Thank you. Here, sit down. All right. What should we find? You reach in. Pick something. Okay. Looking for. It's new things in here. Oh, what did you find? It's a ring.
What?
Look at my mouth. Ring.
What?
Careful. It's a ring.
What?
Look here. Ring.
What?
Good trying. And what else did you find? What is it? It's a ninja.
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 Look at my mouth.
Ninja.
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 Good boy. Ninja.
Ninja.
Nin.
Ninja.
Nice try. There you go. Nice trying. All right. We're going to put these here.
Meow meow.
Yeah, let's pick something else. What else did we find?
Yeah.
Oh, so many sounds to practice.
Yeah.
What is that?
Yeah.
It's a cat.
Catty.
Cat.
Cat.
Good boy. Ready? What does the cat do?
Catty.
The cat jumps.
Jump.
Jumps. Good boy. Ready? 1, 2, 3. Jump. Jump. Uh-oh, he fell down. Uh-oh. Uh-oh. He's all done. All done. Oh, we're gonna leave those there. You can play with them after. When the bag is all empty, then you can pick a toy, okay? Come here, let's pick something else. Let's see. Ooh, what are you gonna find?
Blue.
What did you find?
Blue.
It's blue.
Blue.
It's an eraser.
Blue.
Say eraser.
Alicia.
Eraser. Look at my mouth. Eraser. Look at my mouth right here. Eraser. Nice trying. Oh, don't worry about the camera. What color is it? What color is it?
Blue.
Blue. High five. You're right.
Yeah, so typically, if you have noticed more like a play way with him, and then picking up objects and trying to talk about it and work on the clarity of speech. So, did you get some idea about how a session looks like, a speech therapy session? I'll go back to the slides. Yeah. Now, once they do that initial evaluation, they know that this is the level in which the child is currently, and therefore they set goals for the child once they start working with them. And to set the goals, they need the assessment findings. They also need input from parents and teachers, and what are the actual needs of the child for communication, functional communication needs. Depending on the level of the child, then they see for what does the child need communication for. Is it for basic needs, or is it for a little more higher level, or is it for academic needs? So that decision is also made. And the goals actually follow a SMART principle. That is, goals are specific, goals are measurable, goals should be achievable, they should be relevant, and they should be time bound. For example, the child will name 10 familiar objects during using single words. So it is very specific. It is measurable because we are targeting 10 familiar objects. It is achievable. It is relevant because it is according to the level of the child, and it is time bound. So, for example, if this goal is going to be for the next 1 month, then it is achievable within that 1 month. And if you are creating the goals for one child, it may not work with another child. So the speech language therapist has to plan the session. It has to be individualized based on the child's age, the developmental level, and the interest of the child. Like for a child who does not like dinosaurs at all, you can't keep using different types of dinosaurs and working on counting with them, right? So you have to also look at the interest of the child, the cultural and linguistic background they come from, the parent goals. Parent and the therapist and the teacher should be aligned, the classroom needs. And if there is a coexisting condition, for example, there is a language delay, but it's because of autism, then the goals and the session will be completely different when the child has a hearing loss and because of which the language delay. So a child with ASD may need visual schedules and minimal verbal input. A child with a developmental language disorder may need slow speech and rich repetition. So understanding the child's condition becomes very, very crucial. And how should a therapy session look like? The environment should be calm, engaging, language rich. There should be enough materials which are age appropriate, toys, books, picture cards, or if they're using augmentative communication, the picture charts, picture boards, or the device, whatever. Activities should be very engaging and capturing the interest of the child. Parental involvement should be there. Parents should observe the session, but they should also be coached on what strategy will work with their child. And the goals also need to be discussed with the parent and the teacher. And like we already discussed, it should be clear, measurable, and adapted over time. And we have short-term goals, long-term goals. So short-term goals, as we are achieving, we keep moving, we make new goals as we achieve them. And the parents and caregivers should be made part of the entire process because it is through these relationships that they form with their caregivers, they are able to refine their interactions, daily interactions. The parent-child interaction becomes very, very important. And there are also tailored therapy approaches, like there is something called a flow time approach, which focuses on relationship. Speech therapy sessions are usually 1 to 2 hours a week, but a child spends many more hours at home and in school, and therefore parents and teachers should also be part of the whole process. What happens between the session often determines the child's long-term success. Like this session, the child did so and so activities. The next session, the child did so and so activities. But between that, what has happened? Has there been practice at home? Has there been generalization at home? Right? That will determine the outcomes for the child. But so parents and caregivers are just not helpers for therapists. They are actually communication coaches for children. Some tips for teachers, for parents, caregivers. The best thing to work with at least young children is use their everyday routine moments. Like when they are brushing the teeth, so many more, vocabulary can be introduced to them. When they're having their food, something can be talked to them. Use books, storytelling, encourage pretend play. There is a lot that can come with pretend play, language development. Give choices to encourage speech. Don't just say yes or no questions. Give them two choices and ask them to select one. That way, you're also working on the vocabulary. Give a child time to respond. You can't go on giving instructions. The child needs time to process and then execute them. Reinforce any attempt to communicate. Maintain consistency across home, school, and therapy. You can't have like 5 different vocabulary words in each of these settings, and there is mixed signal coming to the child. Child won't know what to listen to and what to practice. And there are also very good parent programs by this center in Canada called Hannon. I don't know if some of you have heard about it. I've just put it on chat. There are good programs that they offer with certifications. There are some centers in India which offer these certifications. It takes two to talk, learning language and loving it. There are several like that they offer, very, very good ones, curated ones. So through these programs, the Hannon's programs, a basic understanding that I have got is that you need to follow the child's lead. Observe, Wait and listen to the child before you take the next step. Turn everyday moments into learning opportunities. So you sort of embed these exercises or talking or stimulation within the daily routine and the everyday moments. It's not that you make the child sit separately on a small chair, sit in front of the child and start drilling, right? It looks very artificial that way. So when you do it this way, turning everyday moments into learning opportunities, it's more naturalistic and it is contextual and it is also meaningful for the child. You're talking about a hibiscus to a child when you're walking in the park. It has more meaning than making the child sit and showing the flashcard and say, what is this hibiscus? What is this hibiscus? Right? And be face to face, use a responsive style. Always get down to the level of the child and talk to them. Expand and extend what the child is saying. So if the child has come out with one word, then you repeat it as a whole sentence. So it becomes a model for the child. Next time the child can refer to that. Use repetition with variation. So in different contexts, you bring up the same vocabulary words. So then it becomes more generalized for the child. And balance the interaction turns. So you don't go on talking to the child, right? What we generally recommend is 80% of conversation and 20% of instruction to the child. Most often what we as adults do with our own children and with our school children, we do 80% of instruction and 20% of conversation, which is very overwhelming for children. So you need to balance out that. Use visuals and gestures wherever appropriate because it gives them an extra context to pick up what you're trying to say. Create a language-rich environment. Model language without pressure. This is very, very important because you want them to speak in sentences, but you can't ask them to repeat, say the whole sentence, only then I will give the pencil to you. So it becomes very demotivating for the child. So what you do is you model, but don't put so much pressure. You keep using different kinds of sentences, you say it in different ways, use different intonations, but the child will, you have to trust that the child will pick it up from there. Partner with families and educators. And what parents and together can do is share the speech goals and updates regularly so that everybody is on the same page. And maybe you can use a communication notebook or messages to exchange the strategies and progress that you're seeing. Use common words or visuals both at home and school. Attend therapy sessions to learn the techniques used. So only then we'll know what happens in a session and how that can be generalized in our class and at home. But it's not a very easy process also. Referring the child for therapy and then if you're not seeing progress, there may not be visible progress, but the child is moving because these are not like very outwardly obvious things, right? It's processing. So the child is taking time. There is progress happening, but you are not able to see it readily. Then you should not do this. This is one of the common challenges we see. No, he has attended therapy for 3 weeks now. There is no change, so we don't want to continue. So therapy dropout happens. So which is also a not good thing for the child. Uh, and then unrealistic expectations and comparing children. You cannot have, like, you have to meet the child at the level where they are. You cannot have very unrealistic expectations from them. And that will only lead to disappointment. And then you will say, no, they have also been attending therapy for the past 2 months. That child is speaking. My child is not speaking. So it doesn't happen that way because every child is unique and they have their own pace of development depending on the various contextual factors. Now, I'll give you some examples where you feel that there is some concern and you need to send the child for therapy, but actually it's not also, right? As educators, I think we should be very mindful when we are concluding that this child has a problem and then, we are saying they have to attend therapy versus when a child is genuinely having some other issue, and with some kind of push or nudge, the child will be able to do it. Now, this case is a child who's 3.5 years old. He rarely speaks in class, avoids eye contact with the teacher, and prefers to play alone. During group activities, he often seems disengaged. A few teachers express concern that he may be on the autism spectrum. But what's really happening? They moved from a rural area where he spoke a different language. At home, he is talkative in his mother tongue and shows age appropriate play and interaction. He's simply adjusting to the new linguistic and social environment. So, language barriers, cultural differences can be mistaken communication disorders. We need to be mindful of that. There's another child who is 4 years old, refuses to speak in school even though she understands instructions and follows routines. Her teacher suspects selective mutism or a speech disorder. But what's really happening is the child is extremely shy in new environments. At home, she speaks fluently and confidently. Over time, with a trusted adult and familiar peers, she begins speaking in class. So, this is more to do with the temperament of the child or personality of the child, right? It's not to do with any kind of disorder or disability that the child has. So, it's not an emotional problem. A little bit of social anxiety and extreme shyness that the child has. There is this other child who is 5 years old. He avoids reading and writing tasks, scribbles instead of drawing, often looks away during story time. The teacher is concerned about possible learning disabilities or attention issues. But what's really happening? Kabir has mild undiagnosed vision problems. Once he check out glasses, he starts in class and showing interest in books. So physical issues like hearing or vision problems can also appear as learning difficulties or lack of interest, lack of attention. So we need to probe further. There's another case of a child who forgets instructions, loses her belongings, struggles to stay organized. A teacher wonders if they have ADHD or learning disability. What's really happening? Ria is one of the 4 children in a household going through significant family stress. Like they have recently relocated and there are lots of financial issues at home. So the lack of structure at home affects her school performance, but her attention and memory improve with classroom support and routines. Environmental stressors can cause behaviors that mimic disability symptoms. And when you are looking at some of the reports that these children bring, you may be wondering what these terms mean to you. So here's a brief description of what it means. Expressive language delay, they may say, or they may say mixed expressive and receptive language delay. Then what does it mean? Expressive language is what a child can say using words, signs, or gestures. Receptive language is what a child can understand, even if they don't say it. Articulation is the ability to form speech sounds clearly. Phonology, the patterns of sounds children use in speech. AAC is augmentative and alternative communication. It can be any tool that helps a child communicate without talking, or it can also supplement the limited speech that they have. So it could be a picture card, chart, or it could be a board, or it could be an app on a tab, which is like a voice output device. So all these can be alternative or augmentative communication options. Pragmatics is the social rules of using language. Language delay means slower than usual development of language skills. Speech sound disorder is the difficulty in making correct sounds. Echolalia is repeating what others say without meaning. Joint attention is sharing focus on an object or event with another person. Like both of us looking at the same blocks and describing it. or the child points to some object far away and then turns to the parent to talk about that. So all these are joint attention activities. I'll stop here.